You can also see that these discs, 1, 2, and 3, were very degenerative, almost, it was bone on bone.
When Tina Hauser looks at the images of her neck before surgery, she can hardly believe it was carrying heavy groceries that triggered acute pain.
I must have had 40 bags of heavy groceries. And I felt something pull on my neck.
3 herniated discs in her neck wreaked havoc with her arm. The pain was immediate and excruciating.
It just hurt to use it, and it was very heavy and numb and tingling.
Tina went to St. Luke's Baptist Hospital emergency room, where caring doctors gave her something for the pain and ordered an MRI.
I was in shock because it was a quick onset of trauma to me. I mean, I've never had this type of pain before.
A week later, Tina was in a St. Luke's operating room with neurosurgeon Dr. Gerardo Zavala, who specializes in complex and minimally invasive spine surgery.
The minimally invasive surgery, typically patients can go home the same day, if not the day after, for most procedures.
Working through a small incision in the front of the neck, Dr. Zavala is able to cut down on bleeding and the risk of infection. Using special tools, he removes the damaged discs and puts hard plastic spacers in their places. He realigns the neck using an ultra-thin titanium plate and tiny screws. Back problems can also be repaired in this minimally invasive way. When the operation is complete, Dr. Zavala uses a plastic surgery type closure on the tiny incision.
So you actually get no stitches on the outside, no drains. The patients have very little discomfort and are able to go back to work within a week or 2 after this type of surgery.
Dr. Zavala says many people mistake nerve problems for bone and joint issues. Often, though, they need a neurosurgeon, not an orthopedic specialist, to address their pain.
Make a muscle like this.
Just a short time after her procedure,
Move it, keep it real strong. Good.
Tina is almost back to normal and pleased with how it all went.
7 weeks out, I'm happy to be back to doing, 95% of what I was doing before surgery.
If you look at Tina's neck, you can hardly even notice she had surgery.
Yeah, I'm very happy with the outcome.
Now she's got a nice curvature to her neck.
Dr. Zavala says with the minimally invasive approach, patients should have less fear when they're facing neck surgery.
Surgery is something not to be afraid of. Things have really changed a lot. The quicker you get to it, the faster the recovery, the better it is for the patient.
Expert spine surgery to cure your pain and get you back into life. That's the difference. That's Baptist Care. For more information, log on to baptisthealthsystem.com/spine or call 210-229-2289. For the Baptist Health News Network, I'm Wendy Rigby.